Hi, everybody. This is Congressman Mike Levin joining you again for another virtual town hall. Thank you so much for joining us. I'm here in Washington, D.C., got here yesterday, and my great hope is that before I turn around and come back to the district, that we'll have passed not only a bill to keep the government from shutting down, which is so incredibly important, but also desperately needed COVID relief. And I'm heartened and encouraged to see some of the progress that we've made on a bipartisan basis in the last couple of days. And we're going to keep pushing as hard as we can throughout the next several days before the end of the year. I hope everybody had a safe and healthy Thanksgiving. It was obviously a difficult and different holiday for so many, myself included. This was the first time, I was just telling our guest, Dr. LaCroix, first time in many years that I didn't go to travel with my wife's family in Arizona. We got together on Zoom, but I missed them all very much. And I hope that everybody had as good of a holiday as could be expected, given the circumstances. I also wanted to congratulate Jeremy, who does our live streaming, who just a couple weeks ago, I think 3 weeks ago, had a beautiful baby daughter named Emerald. So congratulations to Jeremy. We're grateful for him and all he does to help us live stream these town halls. And I want to thank my entire team, both here in Washington and in the district. They worked incredibly hard throughout all this, and they're just the best of the best. My chief, Kara, and our whole team, our communications director, Eric, who does such a great job helping us with these town halls, and our legislative staff. I'm super grateful for all their hard work. As you probably know, since we saw you all last, we've had just an alarming rise in COVID-19 cases. Certainly, that's been the case not only throughout the United States, but in San Diego County, in Orange County as well. We've had great news about vaccines that we've seen, Moderna and Pfizer and others working incredibly hard. I'm proud of the fact that back in March, the beginning of March, Congress, we passed an $8 billion bill to provide funding, early funding for those vaccines. And that federal investment went a long way, I think, in accelerating what is an incredibly important process to bring that vaccine to as many Americans as we can. I'm encouraged by all of that. We're not quite there yet. Obviously, we're going to prioritize our healthcare workers and those in nursing homes, but my great hope is that certainly next April, May, June, we're going to have that vaccine a lot more readily available so we can eradicate this virus and all move on with our lives. We did, of course, with the recent Thanksgiving holiday and all that it entailed, have what Dr. Fauci has referred to and others have referred to as a surge within a surge. And, I know that it's increasingly difficult to stay away from your loved ones right now, particularly if you haven't seen them in some time. But I would just urge you, encourage you, do everything you can to get through this last phase between now and when that vaccine becomes readily available. We will save many, many lives if we can just get through the next few months. And I know that it will be worth it if we work together and we wear our masks. I've got my mask right here. And if we get tested, and I got tested today, you probably can't see this, but it says I tested, kind of like I voted, but I tested, and we're testing here in the Capitol now all the time. But just to put it in context, the statistics are quite striking. We know that in the U.S., we've had almost 14 million cases and now over 272,000 deaths. In California, over 1.25 million cases, 1,255,000 cases and counting, and approaching 20,000 deaths. New cases have been surging. According to an analysis by the LA Times, over the last week, the state has averaged 14,119 cases per day. That's a 55.6% increase from 2 weeks ago. And roughly 7% of tests this past week have come back positive. So the positivity rate has gone up. The hospitalization rate has also gone up. There are now 8,517 COVID patients statewide. That is a new state record, and it is 98% more than only 2 weeks ago when we last had a virtual town hall. The state is averaging 64.4 daily deaths per day over the last week, and that is really stunning and heartbreaking. As you probably know, the governor has put stricter rules in place. There are now 52 out of the 58 counties in California that are considered at the highest risk, including, of course, San Diego and Orange counties. And we continue to see disparities in age and race in terms of COVID-19. Roughly 74% of those who have died are 65 or older. And after adjusting for population, Latinos are now 2 times more likely than Caucasians to test positive for COVID-19. In San Diego County, we've now gotten a tragic number of over 1,000 deaths, 1,019 deaths, 83,421 cases. We are in the purple tier, as I'm sure you all know. And the county over the last week has reported an average of almost 1,300 new cases a day. That is a 72% increase from when we last spoke 2 weeks ago. The number of hospitalizations has gone up precipitously as well. There are now 685 patients with a confirmed case. In Orange County, 1,578 deaths, slightly fewer cases though, 80,551 cases, also in the purple tier, and over the last week, an average of 1,055 cases a day, which is a 136.3% increase from 2 weeks ago. Now 689 patients in Orange County with a confirmed case. I know I've said this ad nauseum over the past 7-8 months through all these virtual events, but we've got to follow the science, and we've got to do all we can to prevent community spread. And we know how to do it. It's a matter of our will and our desire to keep ourselves healthy and to keep others healthy, whether it be your family, your friends, your coworkers, or yourself. Whatever motivates you, that's what you should use as the inspiration to wear a mask, socially distance, wash your hands, use hand sanitizer, and all the other things we know that will prevent community spread. And I'm going to do everything I can from here in Washington, D.C., to work with my colleagues, both Republicans and Democrats, to try to get another COVID relief bill to the finish line and across the finish line. I can tell you we've made great progress, even in the last 48 hours, with a group of bipartisan senators that moved forward a bill for a little under $1 trillion. And the bill is far from perfect, but I think the breakthrough was that Speaker Pelosi and Leader Schumer said that it would be used as a starting point for bipartisan negotiations that hopefully Mitch McConnell will be willing to engage in the coming days and in the next couple of weeks. Whether we take the provisions in that bipartisan bill and we wrap it into our omnibus spending package that we need to pass by December 11th or not, it is critically important that we get something done now, because people are hurting now. I hear you. We read your emails. We read your letters. We see your comments. We hear your stories. We see you. And we know that in our community and communities all across the United States, people are in desperate need of additional relief, particularly with a lot of the programs running out at the end of the year as the CARES Act created all the way back in March. I can tell you that it's a tough time for us all, but we've got to hang together as best we can. And with that, I am incredibly grateful to welcome once again Dr. Andrea LaCroix. She has been such an incredible guest and has just an amazing background, received her PhD in epidemiology from University of North Carolina at Chapel Hill. I won't bring up the fact that UNC beat my Stanford Cardinal in basketball. Actually, I just did bring up the fact that we have never, just so Dr. LaCroix knows, the Stanford Cardinal have never beaten the UNC Tar Heels in basketball. We had a great chance yesterday, and we blew it at the end. So you beat us again. But so grateful for all your work and your research focusing on the identification of behavioral, pharmaceutical, biomarker, and genetic factors related to the development of chronic diseases, and all the work that you do really throughout your career. Just so grateful that you're here, grateful for your work at UC San Diego, leading the way as a public health expert in our community. And I think this is probably the 8th or 9th or 10th time that you've been with us. Also, you're director of UCSD's Women's Health Center of Excellence, and the author of, it says in the bio, 300 publications. That's amazing.
500.
500. Okay, so we need to update this.
Yeah,
if Eric is watching, we need to update this.
Yeah.
That is absolutely remarkable. But I am so grateful that you're here, and all your teaching and everything that you do for family medicine and public health at UCSD. So with that, I want to turn it over to you for opening remarks.
Well, I share your overall optimism that we as a country are going to come out of this. And I also share your overall sadness that between now and that time, maybe next summer, when things really start to look up, we're going to lose so many of our fellow Americans. So I just wanted to share that the projections this last weekend are that we may get up to 4,000 American deaths a day, which is just incomprehensible. We've been, because of one of the questions that one of my fellow 41st constituents asked this week, our household's been learning about the 1918 flu pandemic, and there were 675,000 American lives lost then. You just told us 272,000 Americans is the estimate of those who have died so far. If we're not, you would think 100 years later we could do better. There are a lot of historical lessons to learn about that earlier time, and we'll touch on some of the things that happen today. It's not so different. We are reliving some of the same mistakes that were made 100 years ago, and I find that kind of remarkable. But I also just am amazingly optimistic. I am just surrounded by beautiful students preparing to lead the next generation of public health studies, by emerging knowledge, like 10 months to 2 vaccines that are 95% effective is just phenomenal. It's never been a more wonderful time to be a scientist and to be just a citizen with faith in the enterprise in America for doing great science. So that makes me amazingly happy. I think there's more bipartisan cooperation right now, getting ready to distribute the vaccine, which is good, and sharing information. And even the White House Coronavirus Task Force issued a message to the public health departments around the country saying you must take greater action to protect the public. Even if the government in which you live will not take action, you must take greater action. So if we are heading to another stay at home, I do hope we'll come together, focus on what we have around us to be grateful for, and find ways to enjoy life that will get us through this winter. My peak experience this week was the Guy Fleming Trail at Torrey Pines. It is just stunningly beautiful. It was remodeled during the shutdown earlier this year, and I encourage everyone in the lower 41st to get on the trail and partake of it. It's really quite gorgeous. Very glad to be here, and you have increased my knowledge by asking these questions, and I'm excited to tell you what I've learned.
Well, you have increased our knowledge by your presence here, and my wife and I love Torrey Pines, and we are absolutely going to do that now that it is open again. The last time we tried to go was closed, So very glad to hear it's open again. We've got a bunch of questions. We're going to get to as many of them as we can.
41st, my apologies, 49th.
I got it. I knew what you meant.
Okay.
We got a bunch of questions, Dr. LaCroix. So I'll start with Nicole in Oceanside, who asked, what is your reaction to the bipartisan relief proposal that was announced yesterday by members of both parties? Well, you got to have a starting point in negotiations. And, for the last several months, we have been largely going it alone in the House when it comes to trying to get another COVID relief package across the finish line. And obviously the pandemic is worse now than it was then in May when we passed the HEROES Act. You might remember we passed a very large and comprehensive COVID relief package back then, which had all kinds of stuff in it. And I shared all of that with you throughout the summer. We then came back and we passed a narrowed down version, still very robust, but a narrowed down version of the HEROES Act. Unfortunately, the Senate did not work with us really on a true compromise. And we were up at around $2 trillion, and Senate Majority Leader McConnell was down around $500 billion. And there was really not a meeting of the minds, despite the fact that Treasury Secretary Mnuchin had agreed to around 1.8, 1.9. At least that was what was being discussed before the election. We then, of course, had the election. The pandemic has only gotten more severe. People are hurting. They are in need of help. And many of the programs that were part of the CARES Act, which we passed back in March, they were extended in April, many of them to the end of the year, but they're going to expire. And we absolutely need to make sure that we get people through as best we can these next few months here until the vaccine is readily available. And very importantly, we have to have the money to make sure that we not only have vaccine, but we have vaccination, that people that are in need of a vaccine can get one, and they can get it at no cost if possible. Certainly that's the objective. So the good news with this proposal from a number of the senators, Republicans like Mitt Romney and Democrats like Mark Warner, when they announced it, we didn't know exactly what they were going to announce. It's not perfect. There are certain things in there that I'm not a fan of, but I can tell you the fact that Speaker Pelosi and Leader Schumer agreed that it should be the starting point for good faith bipartisan negotiations was a big deal. I would consider that a breakthrough. And now the real question is, what will Leader McConnell do? Will he work with us in good faith to try to get something done? My great hope is that he will. He has stood in the way of progress for 7 months. And my great hope is that finally he will come around and he will work with us. That is my hope. Here's the next question. This is for you, Dr. LaCroix. And this is from Sally, who asks, if someone tests positive, I understand that there's a 14-day incubation period. Can that person continue to test positive weeks or months after contracting the virus? It's a great question.
Great question. And a moving target. You heard perhaps today that the CDC reduced the quarantine time from a potential after a possible exposure to 10 days. So I think the 14 days, there must be new data supporting a 10-day incubation period. The answer to that question is yes, you can test positive weeks and months after contracting the virus. And what we know is that it takes about 30 days to clear the active virus after an infection. During that time, there can be false negative tests, but you can also test positive with remnants of the RNA from SARS-CoV-2 up to 12 weeks after. So the answer is yes, you can. You probably have the virus in you for 30 days, and you can test positive from remnants for up to 12 weeks. That's what we know so far.
Wow. Lori in San Clemente, here's another one for you, Dr. LaCroix. She writes, we understand that there may be 2 or more vaccines approved within the next month or two. How does this affect ongoing vaccine trials? will it be difficult to find volunteers? I volunteered for 2 vaccine trials. Thank you for doing that, Lori. They have been in contact with me, but I have not been called to participate as they are not ready for my age group yet.
It's an interesting question because I want to just, my understanding of this question is that if everyone can get a vaccine, will we complete the vaccine trials that are ongoing and still recruiting? And I don't really know the answer for sure, but given the slow rollout over these next several months, I think there'll be lots of people who would volunteer, like young adults who don't want to, who are willing to help and who don't necessarily have access to any of the vaccines that are coming our way because it's going to take a while to distribute them. I think they'll be able to still recruit. The question is, will they be able to recruit the kinds of people that we really need to participate, including diverse race, ethnicity groups and people with underlying conditions of various types, older people, and stuff like that. So I encourage people to participate if they have the opportunity. If you're in one of the high priority, high risk groups, I think getting the vaccine and letting other people participate in the trials is a good way to go. I wasn't prepared to say that a month ago, but I'm so far so impressed with the emerging data on the Pfizer and Moderna vaccines that I think we should get them as soon as we're able to.
Thank you for that. Another one for you, Doctor. This is from Gigi, who writes, have these vaccines been trialed on subjects that have autoimmune diseases and over the age of 50?
So definitely over the age of 50, yes. And in the Moderna trial, it looks like the group over 65 was 25%. It was set at 25%. And then they targeted a variety of other adult groups, including people with underlying conditions. So the comorbidities in the high risk group, they specifically went after people with the comorbidities that make COVID more dangerous. And so there's a lot of diabetics represented in the trial, people with severe obesity, significant cardiac disease, chronic lung disease, and a few with liver disease. But you did not hear autoimmune disease in the list. It's unknown so far because we haven't seen the data. My guess is a few people have autoimmune diseases, but we probably need to specifically pay attention to that group in the future. And there will be many groups of underlying conditions that need more study, even after the first distribution of the vaccine.
Thank you for that, Doctor. Next, from Maura in Encinitas, who writes, I teach at Diegueño Middle School, and I'd really like to see an effort to get teachers vaccinated as soon as possible in California. We are frontline workers too, and our cargo is precious. Please lobby whoever needs to be notified to make this happen. Well, first of all, Maura, I agree with you that you are a frontline worker and that your cargo is precious. Let me tell you that my wife and I are fortunate to have great teachers at our local school district that are doing I think a terrific job under very difficult circumstances. We have an 8-year-old and a 6-year-old at home, and we're very grateful for all of our wonderful teachers out there. You really are heroes, and I know how extraordinarily difficult this year has been. And I agree with you that we have to get you vaccinated as soon as possible. The way that both the state and the CDC is looking at this, and perhaps Dr. LaCroix, you want to add to this, but my understanding is that they're going to focus first on healthcare workers and then focus on those living in nursing homes. And once that is done, then other frontline workers, and I would hope that teachers would certainly be high on the list after the healthcare workers. Now in California, we've got roughly 2.4 million healthcare workers is what I remember reading. And it's going to take quite a bit of time to make sure all of them get vaccinated. But the other consideration is it's 2 shots, right? So the Moderna and the Pfizer vaccine Both require 2 shots, I think 3 or 4 weeks apart. So when the governor yesterday or the day before said there was 300 some odd thousand doses that were going to be available in December of the Pfizer vaccine, that means half that many people will actually be vaccinated. So we've got a ways to go. I'm encouraged to see the cold storage, the freezers and things that are being put in place up and down the state, particularly in some of the more rural and remote communities, to ensure that once the vaccine is delivered and that it is available, that it actually is distributed equitably. So we're going to do all we can to fight for more funding for the vaccine distribution and equitable distribution. And I'm really encouraged that President-elect Biden and Vice President-elect Harris have emphasized equitable distribution. And I think they put together really an A-plus team with the new Chief of Staff, Ron Klain, and others who are extremely experienced when it comes to public health crises. But Dr. LaCroix, any other thoughts on vaccine distribution?
The only thing I would add is that I heard President-elect Biden specifically call out teachers to be prioritized somewhere in the upper part of vaccine distribution, because he and the First Lady, future First Lady, really care about getting kids back in school.
Yes, and she is a practicing teacher as well. And, my 8-year-old over the holiday said, "Dad, when can I get the Pfizer vaccine? I want to go back to school." I said, "I hope you get it really, really soon." And, I know there have to be, I heard Dr. Fauci talk about the need for them to have trials specifically in children. They have to go through phase trials in children, just as they have for adults. But hopefully that'll be sometime next year as well. Next question from Jamie in Oceanside. This is for you, Doctor. With vaccines coming to our seniors, essential workers, and first responders, I feel like our communities can safely reopen and get back to work and school. Is it our state's position to keep restrictions in place for a set duration of time after vaccines are delivered? How can continued restrictions be justified if our higher risk groups are treatable with a vaccine? It's an excellent question.
Excellent question. I do not think it's our state's position to keep restrictions in place for a set duration of time after vaccines are delivered. The tier system will allow us to improve our tier as the infection rate in our community goes down, which it should with greater vaccination in the community. So I expect us to, go down to the lowest level of risk and be able to live pretty normally once, a majority of people are vaccinated. So I'm not concerned about that. Do you know anything I don't know about that?
No, just that, I keep reading and hearing that by Thanksgiving of 2021, we're going to have a lot of turkey and we're going to be all together again. And we're going to get to have holiday parties at our workplaces again. And things are hopefully going to be back to normal.
Yeah, I don't think there's any interest in extending the restrictions longer than they need to be. And I think there will be talk once vaccines being distributed, in the phase 2 and 3 tiers. As we see those infection rates go down, when is it safe to kind of reopen more broadly? The tier criteria lay that out to some extent. I'm sure there are people going to ask, when's it safe for me to go around without a mask? And I've been thinking that as we watch the test positive rate get closer to about 1%, which is when New York reopened, it would also be safe for us. In San Diego County today, our rolling average is more like 6.5, I think. Some days we've been as high as 14. It's been hard for us to go below 3. So hopefully with vaccination, we can get to 1 or below and, feel pretty good about being out there.
Well, realistically, I like the Swiss cheese analogy, if you've heard this, Doctor, where the vaccine, let's say it's 95% effective, masks 70, 80% effective. None of these things are 100% effective. But if you add up the impact of having multiple types of preventative measures that are all quite effective, then you're going to get closer and closer to 100%. Imagine having slices of Swiss cheese. The holes are all in different places. And if you stack them up randomly, eventually you're going to be hopefully not able to see a hole all the way through the Swiss cheese. So that's kind of the idea. And we will obviously need to reopen as fast as we possibly can safely, because the public health crisis and the economic crisis are directly interrelated, and we've got to address both. Francis has a great question for you. Can this pandemic be compared to the 1918 to 1920 pandemic? What ended the pandemic 100 years ago, and what can we expect to end this one?
Well, this is where
easy questions.
This is where I get to shout out to my dear sweet husband, who's a historian and who researched this for me. And I've also been discoursing with Dr. Garfien this week about how fascinating a question that is. So can I take a minute to tell you, just a minute to tell you about the 1918 flu vaccine pandemic? There were 50 million deaths worldwide, 675,000 deaths in the United States, which I already mentioned. We're getting close to halfway there with COVID. This pandemic broke out in the United States on March 4th, 1918, at a U.S. Army camp in Kansas. And there were 3 waves of it. The first one mild in the spring of 1918. World War I was going on, and the soldiers going all around the world were part of the tremendous spread of the pandemic. So the American troops took it to Europe and Africa, South America and the Caribbean, then Russia and the Far East. And when the troops came home, so armistice was November 11th, 1918, that's Veterans Day. When the troops came home, there was further spread over the months following the end of the war. So wave 3 in 1919 was almost as deadly, and there was a 4th wave in the spring of 1920. And after that, the virus started to quote unquote fade away. Well, the truth of the matter is, so I asked the question, when was the pandemic over? When did we get rid of the H1N1 flu virus? And the answer is we never did. It's still here. It has morphed over the years. There's a beautiful paper that Dr. Fauci and colleagues published in the New England Journal in 2009, tracking the evolution of the H1N1 virus from the 1918 pandemic to the present, and showing us the number of deaths, never of which got, thankfully close to 675,000. The virus became less lethal as it morphed during the pandemic, and that is because the virus can't spread well if it sends people to bed and then they die. It has to be able to inhabit the bodies of humans who are out there spreading it, or it won't last. And so less virulent strains of the virus began to be the ones that spread over time. The truth is, though, that we still have H1N1 in its various forms. It's transmitted back and forth from humans to pigs, probably came from an avian source to begin with. And it's a fascinating story. And we try to stay one step ahead of these variants that have come forth since that time. I also just wanted to comment that in 1918, 1919, Americans hated the pandemic. They hated wearing masks. They hated foregoing the activities that they enjoyed. And they didn't want their liberties reduced in any way, just like we're experiencing today. And the cities that most resisted public health measures experienced the most deaths, just like we are seeing in our cities and states today. So it is, they didn't have the internet back then. They didn't have, there wasn't widespread access to the kinds of travel that we can do. But I mean, my goodness, there's so many ways we can entertain ourselves within these public health measures that I think we can do better than we did 100 years ago. Honestly, only because of medicine and our discovery of treatments so far, I'm pretty sure we would have done worse than 1918 if it wasn't for modern medicine and the tremendous response of the healthcare system taking care of Americans who are falling ill. So now it's our responsibility in this surge upon surge to not make their job impossible by enjoying these winter months socially isolated, doing good for our communities in any way we safely can, and getting through this without making the job of the hospitals impossible. You did not mention, but it is worth mentioning that our hospitals are near capacity in California. We haven't even experienced the increase from Thanksgiving yet. And if we're beyond capacity in the hospitals, people will not get the care that they deserve and will not have a fighting chance of making it through. So with that, again, I just want to return to the positive, and that is keep that image of, Thanksgiving 2021 in your mind. Keep next summer in your mind. It's going to be better, and we want to be there for it.
Extremely well said, and I'm really grateful to you for the background on the 1918 and 1920 pandemic. I can tell you with regard to our hospitals, my team is in constant communication with our local hospitals, just asking, what do you need? Do you have the supplies? Do you have the resources? Do you have the beds? And things are reasonably stable in North County based on conversations this week. Because like you, Dr. LaCroix, I read the news of the hospital capacity challenges, and something we take extremely seriously. And we're going to continue to have very close dialogue with our hospitals in the 49th. We're fortunate to have some of the best hospitals anywhere in the state, right in our district or the nation. And we're going to make sure that anything that we can do to help them on a federal level, we will. We're extremely grateful for all the frontline workers at those hospitals who are going above and beyond, many of whom have been through just an unbelievable year and are exhausted and are worn out by now, but continue selflessly and courageously to help people every single day. And we're just incredibly grateful for them, for the doctors, for the nurses, for the others working at those facilities. And we're going to do everything we can, again, to help. Here's another one from Julie in San Diego. Interesting question. Why aren't more doctors talking about and explaining herd immunity to the public, and how and why that works and is so important to attain? And of course, there's been a lot of public criticism of Dr. Scott Atlas and others, the emphasis on herd immunity as a substitute for all the other public health measures, but I'd love your perspective on this.
Well, so there's the yin and the yang. I'm not going to miss Dr. Atlas. I don't think he helped us very much. I think there has been a lot of talk about herd immunity. I've been interviewed about it before. The concept, though, in the pandemic was kind of the Swedish approach, that if you don't try to control the pandemic and a lot of people get infected, the population will reach herd immunity faster, and there will be overall fewer deaths from COVID-19 than if we try to not catch it. And the truth is, borne out in Sweden and the rest of Europe, that not taking public health measures results in so many more deaths that it's not an effective strategy for control of the pandemic. It just kills too many people. And, when I was interviewed about it, I said, I'm all for herd immunity, but what about all the dead people? We cannot allow our fellow Americans to be dying in the interest of herd immunity. The second thing, so herd immunity is what happens when so many people who are living and walking around have been infected that the virus doesn't transmit because these people are immune from previous infection. The other way we can get there is with a vaccine. And so herd immunity up till now has been this arcane concept that we don't have to do public health measures because we're just delaying the acquisition of herd immunity. And that is false. That is That is false. That is not working anywhere. Sweden's had tremendously more deaths than the other countries in Europe that have practiced public health measures. And it just hasn't, it's too lethal of a virus to manage that way. So once we get the vaccine, though, the idea will be that we can get immunity to the virus up through vaccination without the deaths, and then herd immunity will help us. For every virus, there's a different level of herd immunity required. And I remember talking to all of you several weeks ago about measles virus. In the case of measles, where we're almost universally vaccinated, it is a bad disease. And more than 90% of the population gets this vaccine. It's required to go to school, et cetera. You need that level of herd immunity for measles not to be running rampant in the population. We don't know what that is for COVID yet, but we'll be keeping a really close eye on that. And now I think herd immunity can help us, and we can talk, as we see the vaccine being delivered to various populations, we can, they are doing studies over time in the United States of America, various places, to see how many people have antibodies to COVID-19. And so far, it's still very minimal, not more than 10%, even though we've had lots and lots of death and lots of infection. So stay tuned for the good side of herd immunity to be helping us. And I will just say that it wasn't possible to achieve it without tremendous loss of life without a vaccine.
Thank you for that overview. Appreciate it very much. And like you, not a big fan of Dr. Atlas, and far more people will be unnecessarily hurt following that advice than necessary. And much better to listen to Dr. Fauci and others than Dr. Atlas. Jessica in Oceanside has one for me. How do you and your colleagues plan to support small businesses and their employees who will struggle economically during this time? Well, Jessica, we have been trying since the beginning of this pandemic to create a myriad of programs to help small businesses. We initially put several hundred $1 billion into small business relief in the form of Paycheck Protection Program loans. Initially, we thought that 8 weeks worth would be enough. That tells you how little we really knew about what was coming. We expanded that to 24 weeks. We put more money into the PPP program, which was far from perfect. We know a lot of small businesses were unable to get loans. Others who really didn't need the money took advantage of the program. But nonetheless, we did try to help with that, with the SBA loans as well, the Main Street lending facility through the Fed, the EIDL, economic injury disaster loans that helped a lot of people. We didn't stop there. I have tried with my colleagues to get something through called the Restaurants Act that would specifically help our restaurants that have been impacted by this. We're going to keep at it. In fact, we wrote another letter today to leadership about the need to help our restaurants. We also did the Restart Act. That would provide a partially forgivable loan to businesses with a greater than 25% drop in total income since the beginning of the pandemic. I'd love to see that move forward. A lot of these ideas are percolating in the context of this new bipartisan negotiation as well. We have to do, in particular for our industry, we have to address the needs of the travel and the tourism industry and the unique small businesses that support it. Recent report that I saw suggested of the 22 million jobs that had been lost during the pandemic, about 12 million had come back, 10 million still people out of work, 9 out of the 10 million directly related to services, tourism, things of that nature. And so it's clear that we've got to do all we can to help travel and tourism. The other thing, and again, not to be a broken record, but cannot have a healthy economy unless you have healthy people. So we've got to eviscerate COVID-19. We've got to make sure the vaccine is distributed fairly, equitably, and broadly. And we've got to do everything we can around testing and tracing. We are still lacking a national testing strategy. We are still only doing about a third or a quarter of the tests that need to be conducted in the United States. Again, the best thing we can do to support small business is to get the virus under control as quickly as possible so that we can help businesses reopen as quickly as possible. And when I say reopen, I mean really reopen, not with all the restrictions that are necessary under the state's guidelines because of the continued community spread of COVID. Heather in Carlsbad has one for you, Doctor. She writes, Dr. LaCroix, I was wondering if you could please give your thoughts on the safety and or importance of secondary schools reopening and share recent data you may have on the health risks to this adolescent age group if they were to contract COVID-19. We have 2 high school students who are slated to return in a hybrid 2-day-a-week model in January. We understand opening larger schools poses risks to the teachers and staff and greater community as well, and we are trying to make an informed decision. It's a great question.
Great question. And there's a lot of writing and changing of plans going on in California right now because of this new surge. This surge is coming at exactly the wrong time for schools that were hoping to reopen for in-person instruction in the new year, and some were hoping to open certain programs before the end of the year. And it looks like that may not be possible just because of the massive amount of viral spread that's going on in the community right now. I did want to say one good piece of news. I have the table in front of me for the number of cases and deaths associated with COVID-19 by age group in California through the end of November. And so the secondary school age range, 5 to 17, there have only been 2 deaths in California in that age range.
Wow.
So that's very positive. It's not impossible for kids to die in that age range, but it's not happened a lot in California by any means. The problem is that kids can't be at school without adults, without teachers and staff, and they span the adult age ranges that have borne a greater percentage of the cases. So, for example, amongst 50 to 59-year-olds, that's not even considered the high risk. The group that's had the greatest percentage of cases that resulted in deaths in the state of California, it looks like 80-plus-year-olds, almost 8,000 of the deaths, but 35 to 49-year-olds, over 1,000 deaths in California, over 2,000 amongst people in their 50s, 1,600 plus amongst people in their 60s. So all the adult age ranges have suffered a number of deaths in the 4 figures, except for 18 to 34-year-olds. And that's what's vexing about opening the schools is the adult part of it. So I like the idea of teachers being vaccinated early so that we can get kids back to school. There's a lot of literature in front of me here that suggests that kids, elementary school age kids under age 10 are less transmissible than kids over the age of 10. But the WHO says that secondary schools people going to secondary school are very contagious. So kids that are teenagers, if they get the virus, are very contagious and a big source of community transmission. Congressman, the last time we talked about this, Vista was about to open.
Yep. And
do you want to tell that story as a cautionary tale?
Well, I think they were open for not very long. They never opened at all.
Oh, yeah.
Yeah,
I mean, they tried.
Go ahead. I'm sorry.
They tried, but they kept having outbreaks.
Yeah.
So that's really what I have to say. It says that older children may play a more active role in transmission than younger children, which is interesting and not something we understand. But the flip side is that children under 10 seem to be less contagious than teenagers and adults based on viral load studies. So we'll get back there. And we have to be as creative and cooperative with each other as we can to keep the kids learning in between. I hope there'll be some effort across the country to accelerate learning when we do get back to school, and try to compensate for this period that hasn't been so great. And I mean, there's learning opportunities all around us during the pandemic as well, because science is happening and we're part of it.
Absolutely right. Well, thank you for that. Sadie in Dana Point has a great question, and I'll give you the best answer I can, Sadie, knowing full well that there's no perfect answer. Congress was able to compromise on relief bills at the beginning of the pandemic. So what changed? Why is it so hard to get something done now when the economy is even worse? And I would argue when the pandemic is even worse and people are getting it at higher rates and more people are dying as a result. I think it's good to go back and think about the context in which decisions were made back in February and March and April. We, I think, declared a national emergency around March 13th, if memory serves. And it was right around that time that we passed the CARES Act. It was clear that this was unprecedented back then, from all the information we were getting from our public health community. The CDC, the NIH, and others were briefing us repeatedly, both behind closed doors and all the things we were learning in public. And it was clear that we needed a massive response because the CDC was recommending the 15 days to stop the spread, you remember, and then that was extended. But it was clear that people were going to have to stay home, that people were going to be out of work for some period of time. Also clear that tens of millions of Americans lack paid sick leave, tens of millions of Americans lack health insurance, and we really needed to pump a lot of money into state and local governments, not because of any malfeasance by those state and local governments, but because this was an unprecedented challenge that required an unprecedented response. So back then, we did work together and we got the CARES Act across the finish line. We then passed another $500 billion in additional funding for those CARES Act related programs like the Paycheck Protection Program. Then Mitch McConnell said it was time to pause. We passed the HEROES Act in the House in May, at the middle of May, $3 trillion bill. And unfortunately, May, June, July, August, September, October, November, and now here we are, it's December. And we haven't been able to come together on another bill, not for our lack of trying. We passed a scaled down version, as I mentioned at the outset, of the HEROES Act back in August, September. And then there was another proposal of around $1.5 trillion that was brought up by a bipartisan group of legislators. Now, of course, yesterday we saw this $900 billion proposal. We've also seen Republican proposals. McConnell had around $500 billion proposal at one point. It was called the HEALS Act, and even up to about $1 trillion at one point. But timing is everything in politics, and there was a lot of, I think, grandstanding and gamesmanship around the election. And the election's behind us, and it's time for us to come together and get this done, and get it done right away. Because the CARES Act provisions, again, from what we did all the way back in March, are now coming to an end. And the pandemic is now, in terms of the infection rate, in terms of the number of cases, the number of deaths, it's more out of control, not less. I would argue that there were a lot of missteps with testing and tracing early on, and we still, to this day, don't have a coherent testing and tracing strategy. We've had a mixture of state responses. Some have been more effective than others. We can always do the Monday morning quarterback. Hindsight is always 20/20. But where we are today is with an immediate and overwhelming need for action. And I think it needs to happen in this lame duck session before President-elect Biden and his administration begins on January 20th. Here's one for you, Doctor, from Jonas, who asked, Doctor, when do you expect that we'll basically be back to normal and not have to take any more COVID precautions? It's a million-dollar question, million-dollar question.
Great question. And amazingly, there seems to be a growing consensus that that will happen by next Thanksgiving, or the end of next year. Lots and lots of infectious disease epidemiologists are projecting that. And I think the reasons, widespread vaccination, even though, that will create herd immunity eventually. We may have to wear masks most of next year, which is a hard pill to swallow. I realize we're all sick of it, but a small thing that we can do when we're out and about. But I also think this will change. This will be an evolving thing. I'm saying what I'm saying today based on what we think will happen next year. And if more Americans get vaccinated, if that's not a big fight, if there's adequate supply, it could happen earlier. And people, I think, are starting to feel optimistic about that light at the end of the tunnel. I think it's going to be substantially less dangerous by the middle of next summer.
That'll be a great day. That'll be an amazing Thanksgiving next year, for sure. Last question for you, Doctor. This is from Julia in San Juan Capistrano, who asks, when do you think we'll be able to get a vaccine if we're not in any of the priority groups like frontline workers?
So that's still coming into view. And I've got a month-by-month projection in front of me right now based on the CDC's discussions this week, but it's not even clear to me who's going to be in charge of what happens there. Perhaps you have something to say about that, Congressman Levin. But what I'm seeing here is that phase one is massive. The millions of Americans in the phase one, it's going to take several months to get to them. So we have, CDC estimates 21 million healthcare personnel, 3 million long-term care residents, 87 million essential workers, 100 million adults with high-risk medical conditions, and 53 million others 65 and older. And so far, I haven't said any group that I'm in, right? So many of us are sitting there saying, well, I'm not in any of those groups. So when do I get to be vaccinated? And because of those high numbers, it may be until April before people under the age of 65 without underlying health conditions who are not essential workers will be able to be vaccinated. That's what I'm seeing here. Maybe we can do better than that. What are you hearing on the Hill?
Well, just that the new administration will be putting in place, I think, a very aggressive and proactive strategy to distribute the vaccine equitably and broadly. The real key will be getting it first to the highest risk groups, but eventually to the rest of us. What I'm hearing is April, May, June, hopefully, we'll be able to get it to the population as a whole. And I asked earlier this morning, or this afternoon, I was on a call with our chair of House Administration, fantastic colleague, Zoe Lofgren. And I said, when do you think members of Congress will get it? And the answer is, we are not at the top of the list. So we will get it as soon as we can, and as soon as the House attending physician, green lights the vaccine. But I think we're all ready. But obviously, we want our frontline workers, we want those working in our hospitals, those at highest risk of contracting the disease and having the worst effects if they were to contract the disease. We want them to receive the vaccine first. But make no mistake, there is a light at the end of the tunnel. The tunnel is dark right now. It's cold, literally, here in Washington, but there is a light at the end of the tunnel, and we've got to work together to get through this. And I am just grateful to you, Dr. LaCroix, again, for sharing your insight with us. And I'd love to ask if you have any closing remarks this week.
Well, I will just shout out to the students and junior faculty and fellows that I work with. We had a lovely, one of my former fellows who now works at Columbia with us today, telling us about declines in Alzheimer's disease. We're working every day to make the American public healthier, and they're there are a lot of good things going on. So I'm excited to get COVID under control. In the grand scheme of things, every day there are things I just try to think about all the good things that we were able to make happen as a community every single day. What can I feel good about today, and get up tomorrow and do the same thing? And I recommend that we focus on the positive and stick this out, and it'll be over before you know it.
Well, extremely well said, and so grateful to you and everybody at UCSD for all that you continue to do for our community in so many different ways. I want to thank everybody for joining us today. To my family, my wonderful wife, Chrissy, our kids, Jonathan and Elizabeth, my in-laws, my parents, miss seeing my in-laws and my wife's extended family over the Thanksgiving holiday. Want to wish my wife's uncle a speedy recovery from a case of COVID that we found out about yesterday. Hope he's doing well. And I hope that this town hall was informative for our constituents and our viewers. If it was, tell your friends and fellow constituents to check us out. We're going to be doing a lot more of these in the coming year until we're able to have in-person town halls again, which I really miss. That'll be the other thing, Doctor, that we'll be able to do is have an in-person town hall again. We did one a month for the first, I think, 14 or 15 months of my first term. I look forward to doing those again. But in the meantime, we're super grateful to be able to meet with you this way. And we're going to have a lot more in the coming year, more announcements, more exciting things happening with regard to these virtual town halls. I also, on a different note, want to remind everybody that the open enrollment period for Covered California is still underway. And you have until December the 15th to sign up for coverage beginning on January 1st. So make sure that you and your family are covered for 2021 and have the care that you need during this pandemic. And you can visit coveredca.com to enroll now. And I hope you do that. Certainly if you have any questions or challenges, contact our office as well with that. Lastly, I can't stress it enough. I say it every time, but please, please, please follow all the recommendations from the CDC, the state of California, the counties of San Diego and Orange. Do all you can to keep yourself healthy, keep your family healthy, your friends, your coworkers, your neighbors, your community. We've got to work together to get through the next few months. The worst of this, again, the light at the end of the tunnel is coming. We're almost there. We can do it. And I'm very grateful for those of you who are taking those health precautions each and every day. So with that, thank you again for joining us. It's great to be with you all as always, and I will see you in a couple weeks. Thanks, Dr. LaCroix. Thanks, everybody.